Good evening. Thank you for joining our Simon Says Expert Series. My name is Melissa Sherman, and I'm a certified exercise physiologist and cancer exercise trainer. I also hold the American College of Sports Medicine Exercises Medicine Level 2 credential, which signifies that an exercise professional is part of the Exercise is Medicine initiative and can safely and effectively guide patients who need specialized fitness programming. I'm also a research assistant at the Regan Street Institute, and I'm currently a doctoral student in the School of Health Sciences at Indiana University, studying exercise oncology. For the past 2 years, I've had the opportunity and privilege to get to know and learn from this evening's speaker while sharing a common interest with physical activity and exercise research in cancer patients and survivors. This evening's speaker, Dr. Tarah Ballinger, is a breast oncologist at the IU Simon Comprehensive Cancer Center. In addition, she is focused on breast cancer prevention in high-risk patients and serves as medical director of the IU Health Breast Cancer Prevention Program. Her research program is centered around how body composition and physical activity affect patients across the cancer continuum, so from prevention to late-stage disease. Dr. Ballinger received her bachelor's degree from the University of Notre Dame and her medical degree from Indiana University. She completed her internal medicine residency at Vanderbilt University and her oncology fellowship at Indiana University before joining the faculty here in 2017. She currently serves as an assistant professor of clinical medicine and is the Sheila D. Ward Scholar in oncology at IU School of Medicine. And with that, I will turn it over to our expert, Dr. Tarah Ballinger, to present Get a Move on Cancer, Impact of Physical Activity in Prevention, Treatment, and Survivorship.
Awesome. Thank you so much, Melissa. And thanks to the Cancer Center for having me here tonight and everybody for joining us. So as she said, Melissa is a PhD candidate in a relatively new field that we're calling exercise oncology. And I think her being here with us tonight really highlights what's cool about getting to do research at the IU Simon Comprehensive Cancer Center and what's cool about getting care here, which is that we're an academic center. So we have access to experts and disciplines outside of oncology and outside of medicine. And we can really leverage that and learn from that expertise to do better research and also deliver better care to patients. And so exercise and physical activity are really something that definitely highlight that. To do that well for cancer patients, you need a really multidisciplinary approach and you need the buy-in of the patient themselves. So this is really a holistic approach to cancer care. As Melissa said, exercise is beneficial across the whole continuum of cancer, from prevention to during treatment to after treatment to dealing with stage 4 disease and even up until the end of life. So to kind of get us started, I wanted to highlight a couple of definitions just so that we don't get overwhelmed or confused by terms like physical activity or exercise. So physical activity is really any movement of your body that requires energy expenditure. So anytime you're moving your muscles, that requires energy, and that is physical activity. What makes this different from exercise is that exercise is physical activity that has a specific plan and it has a specific goal. So for example, in cancer care, if a patient was going out to walk for 10 minutes around their neighborhood, and that was being done with the specific goal of improving their energy level, now that physical activity turns into exercise. Another definition that I want to highlight is the use of the term cancer survivor. I think that can be a tough term for a lot of people, but what we mean and what I mean when I say it today is anybody who is living with a diagnosis of cancer. So you may have finished your treatment, you may still be undergoing treatment, you may be someone who's never going to be able to stop your treatment. And we are including you anytime we say the word cancer survivor. And when we're working to improve cancer survivorship, we're referring to you as well. What I'm showing on this slide is a graph from cancer.gov showing how exponentially the number of cancer survivors is growing in the United States, estimated to go up to 26 million by the year 2040. And that is not because necessarily that more patients are being diagnosed with cancer, but it's really because our treatments are getting better and better. So more patients are living with the disease and they're living longer. And that's awesome. And that's what we want as researchers and patients and caregivers. But what that means is that millions more people are living with the adverse effects of having gone through cancer treatment, whether that's surgery, radiation, chemo, some of our targeted therapies, immunotherapy, or any and all of the above. And on this slide are several of those side effects that patients can live with during and after treatment. And there are many more that aren't on this slide that individuals experience. What I'm showing here are side effects that through research have all been shown to either be prevented or reduced by physical activity or exercise. And all of these are important, but I'm just going to focus on a couple of highlights today. The most prevalent side effect during cancer treatment or after cancer treatment is cancer-related fatigue. Fatigue is reported much higher in patients who have gone through cancer, even decades out, than in patients who have never been through a cancer diagnosis. And cancer-related fatigue is really different from normal fatigue in that it doesn't often get better with rest, and it can be so debilitating that patients don't even want to eat because they don't want to have to lift their spoon to their mouth. They don't want to have to walk to the bathroom. It can be a really debilitating side effect for many years. And part of the reason it's so hard to treat cancer-related fatigue is that there are so many different mechanisms and causes of why this symptom happens. Although it might seem counterintuitive, even little amounts of physical activity, even though they might seem overwhelming or not possible, can drastically improve cancer-related fatigue. Exercise is one of the only things that has ever been proven to improve this symptom and works better than any medications that we've tried to treat this symptom. And the reason for that is that unlike medicines, exercise is targeting all of these possible mechanisms of cancer-related fatigue. It reduces the physical and mental burden of cancer, so it's reducing the perception of fatigue. Exercise is able to prevent the degradation of muscles that occurs during cancer treatment that can make it hard for people to feel like they can move around. And it also reduces the direct effect of the tumor that causes people to feel fatigued because exercise is anti-inflammatory and helps regulate our immune system. Another really common side effect of going through cancer treatment is loss of muscle and loss of muscle function. So as we age, we lose our muscle mass and we lose the quality of that muscle. And if you go through cancer, that accelerates that aging process and causes more muscle loss and causes the quality of that muscle to degrade faster. So what I'm showing on this slide is a CT scan from a lung cancer patient. And if you've never looked at a CT scan, this is like a cross section through the patient's abdomen. And this is his CT scan 6 months apart. So on these CT scans, the blue is fat tissue. The yellow is fat tissue around the organs. The red is his muscle, and the green is fat tissue that's infiltrating into the muscle that you can see here. And you can see over this 6-month time period that this patient has lost a significant amount of muscle and the quality of that muscle has gone down. But if you just looked at him from the outside, you wouldn't be able to see that that muscle wasting was occurring. And the reason that this is so important is because we know that muscle wasting impacts the function of patients. So that's the ability not just to be able to do things that you want to do, like maybe pushing your grandkid on a swing, but this also impacts the ability to just do your activities of daily living, like dressing, bathing, being able to go to your job. And importantly, this muscle wasting and loss of function doesn't just impact quality of life and your ability to do things, but has also been shown over and over again to be predictive of worse survival after a cancer diagnosis. So exercise, and in particular resistance exercise to keep the muscles strong through treatment and after treatment, is important, not just for quality of life and for physical functioning, but also to actually improve survival after cancer. Another common side effect that a lot of cancer patients face is breathlessness or shortness of breath. Many patients are anemic or deconditioned from their therapy, and there's less oxygen transport to the muscles. And this can really make exercise feel really daunting and also even feel really, really uncomfortable. This is especially true for lung cancer patients, many of whom actually have to have part of their lung removed as part of their treatment. But even in these patients, exercise is very safe, it's very possible, and it's very beneficial. Multiple studies have shown that structured, supervised exercise like pulmonary rehab done before lung surgery, after lung surgery, even into advanced lung cancer with a terminal diagnosis can be beneficial. Particularly in lung cancer patients near the end of life, they really suffer from a terrible feeling of not being able to breathe. And physical activity can really help with that sensation and also improve their functioning and just improve how they feel about themselves. One study I wanted to mention that was recently published took patients who had too bad of lungs to begin with to be able to go to the surgery that would cure their lung cancer. And all of those patients enrolled in pulmonary rehab. So twice a week, they did aerobic exercise, walking on the treadmill, like the woman in this picture, and also doing stretching and strengthening exercises for those breathing muscles. They did that just twice a week for only 2 to 4 weeks and improved so much that 56% of the patients were able to go to that curative lung surgery. Another disease-specific side effect, and this is one that I see a lot as a breast oncologist, is lymphedema. So lymphedema often happens to breast cancer patients, melanoma patients, or other cancer patients that have to have some of their lymph nodes removed. And the reason this happens is once your lymph nodes are removed, that lymph fluid can't drain out of that limb. And so it can become really heavy and swollen and difficult to use, like you can see in this picture here. And that can really be a detriment to your function and to your quality of life. But we've proven in several different research studies that, again, we can prevent this with exercise. So a clinical trial that was done had women do progressive weightlifting for a year after their breast cancer surgery. And this reduced the incidence of getting lymphedema in the first place by about 70%. It also improved the women's muscle mass. It improved their functioning and kind of the difficult sensations that women with breast cancer can get over their chest and upper body. So we used to think that exercise was going to make things like lymphedema worse. You know, if you use that arm, maybe the swelling will get worse. But what we've proven over and over again is that the opposite is the case, and it actually prevents it. And this is likely from something called the hormetic effect. So what this means is when you exercise, there are small increases in the stress that your body feels. And this kind of trains your body to be able to respond better to infection, inflammation, and injury. And so it's better able to respond to the side effects of cancer treatment. These are just a few of the side effects that we can prevent or treat with exercise and physical activity. But even beyond helping patients feel better, physical activity and exercise can actually reduce death rates from cancer. This data doesn't yet exist for all cancer types, but has been repeatedly shown in particular for breast, colon, and prostate cancer. So the data I'm showing on this slide comes from something called a meta-analysis. A meta-analysis is where we combine together several really big research studies so that we have a really big database and can make much better conclusions. And this found that higher levels of physical activity after a cancer diagnosis is associated with a 38% reduction in cancer-specific death in these cancers. So we're not talking about exercise preventing death in general or preventing death from cardiac disease. We're talking about exercise actually reducing death from cancer. And to put this in a little bit of perspective, there's a medicine that we commonly give to breast cancer survivors called tamoxifen. And tamoxifen is an anti-estrogen medicine that we give to breast cancer patients to lower the risk that their breast cancer will come back. And tamoxifen, taken for 5 years, reduces the risk of dying of your breast cancer by about 39%, which is really similar to the benefit we would see from physical activity. And I highlight that not to say that I think exercise should replace cancer medications, but to make the point that this serves as a really important adjunct to treatment to further improve survival rates from cancer. And also to say that we spend billions of dollars to develop cancer drugs. We spend billions of dollars to treat the side effects and billions of dollars to help patients take the drugs. But we don't do that for exercise, something that is already often freely available. And we really need to use our resources to help patients be able to do this and take advantage of the benefits. So how exactly is it possible that exercise could reduce death from cancer? And again, there are likely several mechanisms that exercise hits to reduce cancer-specific progression and death. One of those is that exercise often changes the composition of the body and increases skeletal muscle while decreasing fat tissue. So fat tissue is pro-inflammatory, so it's pro-cancer, while muscle is anti-inflammatory and also helps regulate our immune system and insulin metabolism, all of which are involved in cancer progression. Exercise also improves cardiorespiratory fitness, which is a major predictor of death from cancer. And even if you're exercising, most people exercise because they want to see those body composition changes. But even if that's not happening, each bout of exercise is like taking a medicine and it causes physiologic changes in your body. So with each time you exercise, that's improving insulin metabolism, inflammation, DNA damage, oxidative damage, how your immune system can survey your body for cancer. All of that improves with exercise. This slide looks a little bit sciencey, but bear with me for a second. I just wanted to highlight, sometimes I think it really helps to understand how exercise is involved with cancer cells. So cancer cells have a really erratic blood supply, and this makes it so that our killing cells and our immune cells can't get to the cancer. It also makes the oxygen levels inside the cancer low, which is what causes the cancer to have a funky metabolism and actually what inspires it to grow and spread through the body. But when you exercise, this actually regulates and normalizes the blood supply to the cancer so that the killing cells and the immune system can get there, recognize the cancer, and be able to fight it. So we know that exercise is safe. It's safe if you have lymphedema. It's safe if you have stage 4 cancer. It's safe if you've had part of your lung removed. It's safe if you have bone mets. It can improve side effects and it can improve survival. And so based on all of that, there are guidelines that exist saying that cancer patients should be exercising, and the old adage of saying that we should rest and take it easy during cancer treatment is no longer recommended. So the official recommendations for cancer survivors are actually the same as the general population, which is for about 2.5 hours of moderate aerobic exercise per week. So that's something that's getting your heart rate up and making you a little bit breathless beyond your normal daily activities. They also recommend 2 or more days a week of resistance training that doesn't have to be weightlifting, but just something that really puts your muscles under tension. And having these kind of guidelines is great, but the problem is that patients aren't doing this. And we as oncologists and a healthcare team are often not talking to patients about this. I did a survey of cancer survivors here at our cancer center, and less than 25% were meeting these physical activity guidelines. It was less than the national average for cancer survivors, which really goes along with the fact that Indiana is a state in the US that is more sedentary and less physically active. But one major problem with these guidelines, obviously, is that one exercise prescription is not going to fit everyone. Not everyone is ever going to be able to do that. And certainly if you're doing 0 minutes of exercise a week, you're not going to be able to go out next week and do 150 minutes. And an exercise prescription is only going to work if the patient actually fills the script. So that exercise prescription needs to be individualized for the capabilities, the environment that the patient is in, and their treatment plan. So again, it's going to be really different for everyone. And to highlight that, I just want to illustrate a couple of the patients that I've had the opportunity to work with over the years. So the first one is Kim. Kim was diagnosed with a stage 2 breast cancer a few years ago. When she was originally diagnosed, she was morbidly obese. She struggled a lot through her chemo. She struggled to recover from her breast surgery and her breast reconstruction. And then she was placed on an anti-estrogen medicine that just made that weight gain worse. And she also had a lot of chronic pain left from her chemotherapy. So she knew that exercise is something that can help with cancer-related pain, certainly is something that can help you lose weight and can reduce the risk of your breast cancer coming back. So she decided that she was going to take this on and started waking up every morning at 6 a.m. to move her body. First, she was just walking for a few minutes, but now a few years later, she's lost more than 100 pounds. And she does a high intensity walking program and a strength training program every morning or a few mornings a week for about an hour. The next patient is Ivy. So Ivy was diagnosed with a stage 3 breast cancer early in her 30s, and going through chemo left her with weight gain, infertility struggles, a lot of issues with fatigue, depressed mood, anxiety. And she actually enrolled in one of our research studies doing exercise for young adult cancer survivors. And Melissa actually worked with her as one of her trainers. And through that exercise program, she didn't lose weight, but the reason I highlight her is because her strength improved a lot of her upper body symptoms improved a lot, her fatigue, and I think most importantly, her mood benefited and the way she felt about herself through that exercise program. Charlene is a patient who's actually an elite runner, and even late into her 60s, she was running marathons, which is super impressive. But during chemotherapy, she was receiving a medicine that is toxic to the heart muscle. So we worked with a cardiologist and really planned out a running program for her. She kept close attention to her heart rate. And by planning that out, she was able to maintain her fitness through chemo and actually qualified again for the Boston Marathon this year. At the other end of the spectrum is another Charlene. So this Charlene has both stage 4 breast cancer and stage 4 uterine cancer. And she had tumors that were wrapped around her spine that actually caused her to not be able to use her legs. She had surgery, radiation, and has been on a targeted therapy medication, but that still left her unable to walk and unable to really care for herself. But she was really dedicated to working with physical therapists, and she now does a home-based exercise program that just consists of using resistance bands, and the cardio is kind of just marching in place in her chair. And by doing that over time and being really dedicated to it, as you can see in this photo, I took this in clinic this week. Actually, she's standing and walking now, which is awesome. So what all of these patients have in common and why they were successful is because for each of them, there was a goal and there was a plan. So there are a few things proven in research and in practice to make these kind of exercise prescriptions successful. So the first is having a goal. You have to understand why you are doing this. Maybe it's to improve your survival for cancer. Maybe it's just something like being able to take your son to the park. So maybe have him record a video saying how important that is to him. And when you get up in the morning and you can't find that motivation, watch that video. The second thing that's important is having social support. So this can come from family and friends. But importantly, make sure it's family and friends who are helping you do what you need to do and aren't projecting on you what they think you should be doing. So people that are just going to really support you in the goals that you outlined. But it's also important to get social support from your oncologist and your healthcare team. So ask them about this. Sometimes it's even helpful for your oncologist to put your exercise prescription on a prescription pad. The other thing is the how of doing this. So you really actually have to plan it out, get a planner, write it down, check it off, try to do it the same time each day and a few times a week. That's what really gets our brains to feel like we're doing something that's a habit. And the exercise program should consist of aerobic exercise, resistance exercise, and stretching and flexibility. And we'll touch on each of those real quick now as well. So aerobic activity is anything that's getting up your heart rate and your breathing. So this is something more than just the normal walking you're doing at work or your normal activities in your daily life. So this is something that you're doing that's making you breathe a little bit hard. Again, different for everyone. Some people have to run on a treadmill to feel that way. Other people just have to walk down the hallway. And if that's you, then maybe that's something that you're doing a few times a day, but you're pushing yourself to get to that aerobic threshold. The other component is resistance training. So again, this is something that's intended to build muscle, which really fights fatigue and improves quality of life. Also really can improve how you feel in response to treatments, particularly chemotherapy. And this, again, doesn't have to be weights. It can be resistance bands. It can just be your body doing a push-up on the kitchen counter, just sitting and standing repeatedly from your chair. And there are a lot of other things that you can add into these programs. Flexibility is really important. Balance is really important. A lot of cancer patients will get something called neuropathy. So doing things like standing on one foot while you're brushing your teeth, just really being mindful about maintaining your function while you're going through treatment. What I put on this slide is just a few resources that you can use now, some of which cost money and some of which do not. So the Live Strong program at the YMCA is something that is often freely available to cancer survivors through philanthropic donations. If you go to a YMCA near you and ask about this program, cancer survivors can work with a trainer usually for about 12 weeks, and that'll really teach you what you're capable of and what you can be doing. Revital is a cancer rehab clinic. They have several sites throughout Indiana. Karuna Precision Wellness is a center here in Indianapolis that takes a really holistic approach to cancer care. They have acupuncture, massage, and access to cancer trainers. That does cost money, but has financial aid for those who qualify. My favorite kind of cardio resource to give to patients that can't join a gym or have reasons, either they live in a bad neighborhood or the weather's bad, they can't go outside, is called walkathome.com. It's $5 a month. They have really awesome workouts that you just do in your living room, and they're perfect aerobic exercise. The American College of Sports Medicine has lists of cancer certified trainers like Melissa, so that you can find one if that's something you're interested in. But in general, just talk to your oncologist, tell them what you want to do, and get them to help work with you to get you where you need to be. And in the future, my goal in partnership with our cancer center is to create a really comprehensive prehabilitation and rehabilitation for all of our patients, all of our cancer survivors. The goal of the multidisciplinary oncology, vitality, and exercise program is to integrate into our cancer care assessments of patients' function, formal rehab, exercise resources, and just overall better supportive care into the cancer-directed care that we are already giving. So the way that this will work is that patients are going to be assessed by a cancer specialized physical therapist. And that assessment will include physical activity, physical function, a lot of symptoms, where you're at with your mental health and things like that. And based on that assessment that we have all worked on as a group, patients will receive a personalized prescription for support, and maybe that's continuing to work with a physical therapist. For certain people, that will be referral to exercise programs, and those exercise programs might be one-on-one with one of our trainers, or it might be getting plugged into a community resource. It might just be a prescription to do the exercises on your own if that's something that you're capable of. But also importantly, this program will integrate support of a lot of our other services that are underused here, like massage therapy, psychosocial support, pain management, because physical activity and physical activity prescriptions are really important, but there's also so many functional impairments that happen from cancer treatment that are listed here on this slide. And so this program would be designed to really help you where you need to go, get where you need to go to prevent those deficits from happening in the first place. So that is all I have for our formal talk, and I really appreciate everybody again for tuning in, and feel free to reach out to me in the future with anything. And I know we've, Melissa, I think we have some questions.
We do. Thank you so much, Dr. Ballinger, for the presentation was great. We did receive some questions. So one question we received was somebody who's very curious about the ability of exercise to possibly prevent cancer. So Dr. Ballinger, I know you mentioned information for the prevention of recurrence, and that physical activity is associated with a lower risk for several types of cancer, including breast, prostate, and colon cancers. And I also know you mentioned physical activity can regulate some hormones that contribute to the development of cancer and help the immune system stay healthy and strong. So Dr. Ballinger, what do you usually tell patients in clinic about cancer prevention?
Yeah, so as you mentioned at the beginning, I direct our breast cancer prevention program. And in that clinic, I see a lot of women who haven't yet been diagnosed with cancer, but maybe have family members with cancer or are at higher risk for other reasons. And so very similarly to this, as you mentioned, the same mechanisms and the same reasons that prevent recurrences of cancer, prevent cancer from happening in the first place. So there are many different types of cancer that have been proven to be reduced in patients who are physically active or in patients who have healthy body weights. So in patients particularly who are at risk because of family history or other things like that, and really want to know what they can do to lower their risk, those lifestyle changes are so important. The same evidence exists in that space.
Absolutely. Thank you, Dr. Ballinger. The next question, what are the implications for exercise for multiple myeloma patients?
Yeah, that's a great question. It would be, you could really give a whole talk about the role of exercise for each of these individual cancers. So multiple myeloma, for anybody who doesn't know, is a blood cancer. It's a cancer that can often be really difficult to treat. And a couple of the main symptoms of multiple myeloma are that it lowers blood counts. So that can really make people weak and can really make people at risk for infection. Multiple myeloma, similar to breast and prostate cancer, really likes to attack the bones. So patients with multiple myeloma often have a lot of cancer spots in their bones. And they often have really weak bones. And so the main role of exercise in multiple myeloma is really to prevent that deconditioning that comes with being anemic. So like I mentioned, that lower oxygen transport to the muscles is really what starts decreasing function, and exercise can prevent that. Similarly, with really weak bones, in particular, resistance exercises can really help to strengthen the bones. And I don't know, Melissa, if you can comment on having worked with cancer patients. I think people often worry what to do if there's a specific limb that bothers them, or they have a bone met in a specific area, or have one leg that gives them pain. How do you usually sort of address those impairments and make exercise prescriptions for those patients?
Absolutely. So I think one of the main things on an individual one-on-one basis, the modifications are so important. which allows us to be able to maneuver around that and make the activity work, and minimize any sort of discomfort that the person might be having. But I think you hit all the main points that, that I think of when we think of somebody who has multiple myeloma, as far as with their blood counts and being able to handle a workout. And also, one of the things I think about too is if they have a low white blood cell count, their immune system is compromised. So they may want to, the intensity of the exercise is important, wearing a surgical mask if they're working out in public. I think I just lost my light. There we go. Sorry about that. Or changing the exercise venue even. And like you mentioned, just the importance of sticking with it, and minimizing and working around some of the things they might be experiencing. So.
And it's really, I know that when we've worked with training cancer patients, we always talk about like the rate of perceived exertion. So that's sort of what's important. So, as cancer treatment may be making things seem harder to you, it's still really the purpose is to make sure that you're pushing yourself. Is that correct?
Absolutely. Yes. So our rating of perceived exertion, just how hard you feel like you're working. So we can tell you what to do, but it's most important to see how you're feeling when we're working out. So it's just, again, that's exactly right. When we're coming up with exercise prescriptions and when we're going through each exercise that we do, we always are asking what you would rate your RPE and for that exercise. So, our rating of perceived exertion scale, it goes from 0 to 10. So 0 would be no exertion at all. And then 9, you're extremely hard, and 10, you wouldn't be able to continue. So we try to find the right place to be for that as well. So that's a very important factor when we do the exercise prescriptions as well. So that's a great point. Next question that we received is, what types of exercises are most beneficial for cancer survivors? Aerobic, lifting, or stretching? And I know that's a really common question that we get. And Dr. Ballinger, I know you mentioned throughout the presentation the recommendation for physical activity for cancer survivors, which includes all of those. So the aerobic exercise, the weight training or resistance training, and flexibility. And they all are critical to the overall health and well-being of cancer survivors. As far as, I know you've mentioned some studies, and several studies suggest that the higher levels of physical activity are associated with a reduced risk of cancer coming back and longer survival after cancer diagnosis. And also just those other things, like you said, like reducing fatigue, boosting self-confidence, improving mood, feeling stronger as well with that.
And I think it's also important, the like I kind of mentioned, the prescription that's going to work the best for you is the one that you're going to fill. So we can talk about what the best recommendations are, but part of it is, as you mentioned, a really individual thing. So some patients prefer more resistance exercise and some patients prefer more aerobic exercise. Some people want to exercise in a group. Some people want to exercise alone. Some people want to be at home. Some people want to be outside. So part of it depends on, to be able to find that intention and that motivation to do that. It has to be something that you like to do. But I do think understanding what you're doing it for can help. So I think often when I work with patients, if I can tell them why a certain symptom that's really bothering them would benefit from a certain type of exercise, that really motivates people to start doing that. So again, it's such a difficult question to answer which specific exercises, because it depends on the person and it depends on, the primary goal and the primary symptom that they're trying to manage.
Absolutely. And I think, when I think of individuals and that are being trained, so if somebody likes walking, then choose that modality. Or if somebody likes swimming, choose that. There's so many different avenues to being physically active. And, we don't want to disregard even things like outside, yard work, gardening, things that are getting your heart rate up as physical activity, especially if you are sedentary. Those little things add up and do make a big difference in the outcomes and get you moving. So it's really important to find things you enjoy to do.
Yep.
The next question that we received, Dr. Ballinger, is what is the referral process for patients needing physical or occupational or speech therapies if those are needed?
Yeah, that is a great question. And as I mentioned, I think one problem in cancer care is that we're so focused on treating the cancer and curing the cancer, which is great. And that's the ultimate goal, but we really need to do a better job of focusing on all of these supportive care avenues. So if you're interested in physical therapy, occupational therapy, speech therapy, and no one brought that up to you, really advocate for yourself and ask for that. The best way to get that arranged is with a referral from your treating oncologist or even your primary care doctor. Again, what we're developing here at the Cancer Center is a structured way to get patients who need them into those services in a way that the patient doesn't have to ask. And the treating oncologist is in charge of treating the cancer, but we've got this whole support system built around the patient. But the best way to do that really is to ask your oncologist for a referral.
The next question, how to support a loved one with metastatic disease. So helping with improving their physical activity with so much pain involved.
Yeah, that's so tough. And as I mentioned a little bit in the talk when I was talking about social support, the dynamic between a cancer patient and their loved one can be often difficult, especially, the loved one wants so badly for the patient to do well. And so sometimes that can be a little controlling or difficult for the patient when they really want to do what the loved one wants them to do, but they just feel like they can't. And that can be a really difficult space for families and friends to be in. So I think, again, every little bit helps. And I didn't touch on this particular side effect in the talk, but cancer-related pain, similar to cancer-related fatigue, it seems counterintuitive, but physical activity and exercise can really help relieve that. So even little movements, stretching, getting up, getting down, it's even been proven that at the end of life on hospice, that movement helps people feel better and feel less of that pain. So I think it's just important to be patient and be supportive and not get frustrated, but know that that is important. And if you're having trouble figuring out how to do it, again, ask your oncologist so that you can get to a resource that could really show you how to do that well.
Absolutely. And next question is, how do you fight the fatigue that to continue to be physically active?
Yeah, I think, again, I feel like I sound like a broken record, but I have this discussion with my patients all the time too, because it seems like it's not what you should do, but cancer-related fatigue does not get better if you take a nap, like my fatigue does, like when I get home from work. When you have fatigue from cancer, it's not going to get better with rest. It really gets better with movement. So if you feel like you need to lay down and take a nap, just go outside and walk around the block and just keep trying to maintain as much as you can. And in the long run, that fatigue is not going to be as detrimental. I think I hate the phrase in cancer, new normal. A lot of people will say like, oh, well, I guess being this tired is my new normal. But I don't think that that's something that we should accept. We need to get patients back to how they were before their cancer diagnosis. And that's not just going to spontaneously happen. That fatigue isn't going to get better if you don't fight it. And so really getting moving is the best thing to do for that. And again, I think it's a responsibility of the healthcare team and the cancer center to help patients do that. And so that's what we're trying to build for the future.
Absolutely. And you're exactly right. I love how you say, it seems counterproductive that we wouldn't think that, but it is, like you said, the number one way is being physically active and making it a part of your routine to put you on that road. And one of the things I always think of with that as well is, you can test it out. Do you feel better sitting on the couch or actually getting out for a walk? And you can test it out that way and see which actually makes you feel better.
Yep.
And we did have a couple more questions. And I think this is similar to one that we've already touched on, but when considering exercise therapy, is cardio or strength training shown to be more beneficial?
Did you lose your light again?
I sure did.
When it comes to what is cardio training or resistance better?
Shown to be more beneficial.
Yeah. So it depends on the outcome. So when you say, is it more beneficial? It depends on, do you mean, is it more beneficial in preventing cancer? Is it more beneficial in maintaining function? Is it more beneficial in fighting fatigue? So it depends on what the person asking the question is getting at. There is in terms of cancer survival, the most evidence exists for aerobic activity. So in terms of improving survival and reducing progression of cancer, aerobic activity, getting your heart rate up, is what causes more of those physiologic changes in the body. But again, like I mentioned, muscle mass also matters for survival. So I try to encourage people not to think of, should I do this or this, and try to figure out how to combine both of those components into their exercise. There are certain things, like if you're asking what's more beneficial to my bone health, then the answer certainly is resistance exercise or anything that's putting strain on the muscles. But that can happen also from walking. So really, it's both of those components, and I would try not to think of it as which one's better than the other.
Absolutely. I couldn't agree more. And then there are one more question here. Are there any good references for resistance exercises that can be done at home without a lot of expensive equipment? So somebody with a weakened immune system and not being comfortable going to the gym or to work on weight machines that way because of that.
Right. So one good thing to do is to go on Amazon and just get a cheap set of resistance bands. Then you can do a lot of these same activity. You can put that same strain on your muscles in your home without a lot of equipment. There are resources specifically for cancer patients with some strength training routines built in. Most of those, and Melissa, you can probably speak to this too, a lot of those good resources are on the American College of Sports Medicine website. There's an initiative that we mentioned a little bit called Exercise is Medicine, and they have a specific cancer program and specific cancer-related exercises. I might even be able to try to pull up that website so I could share it with everyone. I don't know if you know, Melissa, what the name of their program usually is, but if you go to the American College of Sports Medicine, Exercise is Medicine, there's a lot of resources. It'll link you to cancer-specific exercises. There's YouTube videos, there's PDFs. So that's a great resource because it was made by people that are specifically thinking about cancer patients.
Absolutely. And I think, as far as, one of the things with the last year or 2 years here is that there are so many more things available via Zoom or videos or working with trainers one-on-one via Zoom. So there are a lot of things, and you don't need any equipment, but, body weight exercises and those things do matter and make a difference as well. So there are a lot of resources out there. And what Dr. Ballinger mentioned is exactly right with the ACSM website there. So I think that is it with our questions. So thank you again, Dr. Ballinger, and thank you everyone for attending the Simon Says Expert Series. I do want to remind everyone that the session is being recorded, and a link to the session will be on the Cancer Center's website, as well as the Facebook page. So thank you.
Thank you. Have a good night.